So let's talk about the engine that drives modern healthcare forward, nursing research. It's this, systematic, scientific process that gives nurses the solid evidence they need to provide the best possible care. But how does this kind of invisible engine actually work? Let's dive in and find out.
You've probably heard this question before, right? Is nursing an art or a science? And for a long time, you could make a pretty good case for either. But honestly, in today's super complex healthcare world, the answer is getting a lot clearer. The compassion, the connection, that's absolutely an art. But the practice itself, that has to be grounded in the hard evidence of science.
For generations, nursing really relied on two things: tradition, what was passed down from nurse to nurse, and a nurse's own intuition. But modern nursing has made this huge, critical shift. It's moved away from a practice based on, well, this is how we've always done it, to one that's firmly, and I mean firmly, rooted in evidence and research. This makes sure that the care you get isn't just well-intentioned, but that it's also effective, efficient, and most importantly, safe.
So how does research actually build this whole scientific foundation? Well, it all starts with two essential building blocks. First, we have to clearly describe what's happening, and then, once we know that, we can start to explain why it's happening.
The very first step in any scientific journey is just to see and to document what's actually there. Descriptive research is all about identifying and cataloging things just as they are, in their natural state. It's about getting a really clear, unbiased picture of a situation before we can even think about doing anything about it. Okay, think about a study that isn't trying to solve a problem, but just wants to understand it. Researchers might just observe and document the specific kinds of stress that parents of children with leukemia are facing. The goal here isn't to intervene, not yet. It's just to get those crucial insights that help us really understand that family's experience on a much deeper level. And this table right here, it's a perfect example of description in action. It's just cataloging patient characteristics, their age, smoking history, different health metrics. This isn't an experiment. It's a snapshot. It's a baseline of what is. By clearly describing the group of people they're studying, researchers can start to spot patterns and really lay the groundwork for asking much deeper questions later on. Okay, so once we've described what is happening, the next logical question is why? This is where explanatory research comes in, and it digs a whole lot deeper. It tries to clarify the relationships between different factors and pinpoint the reasons behind certain health outcomes. This is how we start to connect the dots. Now, this foundation of describing and explaining is what lets us move into the application phase. With that knowledge, research gives us the power to start predicting what might happen next, and in some cases, even controlling the outcomes to make things better. Prediction is, without a doubt, one of the most powerful tools in the entire research toolkit. By analyzing patterns from all that earlier descriptive and explanatory work, we can actually forecast the likelihood of a specific outcome. And this is a total game changer because it allows healthcare to shift from just reacting to problems to proactively preventing them. So here's a really practical example. Nurses use these validated assessment scales to predict a patient's risk of developing really painful pressure ulcers or bed sores. This isn't just a guess, it's a calculated probability that's based on solid research. And by predicting that risk, they can step in and do something before the problem ever even starts. And that brings us to the most active purpose of nursing research: control. This is where we test our solutions. This is where the rubber meets the road. Control means designing an intervention, tweaking a situation, and then carefully measuring the result to see if we can produce a better, more desirable outcome for the patient. This process shows you exactly how we test something out. So first, you identify a problem, right? Like high rates of pressure ulcers in a certain unit. Then, you design a potential solution, maybe a new type of therapeutic mattress. The crucial part is the controlled study, where you test it and you carefully measure the outcome. Do patients on the new mattress actually do better? This is how you prove an intervention really, truly works and build up that evidence. So we have description, explanation, prediction, and control. But where does all of this lead? Well, it all funnels into one ultimate goal that really defines all of modern nursing: evidence-based practice. Now, what's so important to get here is that evidence-based practice, or EBP, isn't just about spreadsheets and data. Think of it like a three-legged stool. One leg is the best scientific research available. Another leg is the clinical expertise of the nurse. And that third, critical leg, it's the unique values and preferences of the patient and their family. All three have to be there. So the whole mission of EBP is really clear: to make sure every single patient gets the best possible care. It's about ensuring that what nurses do is not only effective and safe, but that it actually improves outcomes, all while being smart about costs. It's the final, practical destination for all the research we've been talking about.
Take a look at this number, 17 years. What do you think that represents in healthcare? I mean, it seems like an eternity, doesn't it?
Yeah, that's the shocking average time it takes for new research discoveries to become routine, everyday clinical practice. Why so long? Well, it's a complicated mix: old habits, communication breakdowns, just the sheer volume of new information out there. The whole framework of evidence-based practice is designed specifically to close this gap and get life-saving innovations to patients so much faster. So let's bring this all together. Why does nursing research really, truly matter? It's not about writing dusty academic papers. It's about fundamentally elevating the entire profession and, most importantly, the quality of care that all of us receive. Nursing research is what validates nursing as a true scientific profession. It creates that strong scientific basis for practice, it builds a unique body of knowledge, and it gives us the hard data we need to document the huge impact that high-quality nursing care has on patients. And this documentation, it isn't just for show. It's about accountability. It's about proving the value that nurses bring to the table and making sure their contributions are seen and properly supported. So I'll just leave you with this thought. The next time you or someone you love is getting medical care, it could be a simple procedure, a complex treatment, whatever, just take a second to think about that invisible foundation of research that made that care possible, that made it safer, and made it more effective. It really is a quiet revolution that's happening every single day.